So, as we sort of previously discussed, we think population health is around a new way of working, a new way of partnership working, and therefore, to some extent, is never going to be something that can be driven from the top down. It needs to equally come from the bottom up, and to have people on the coalface of providing services to our residents and our patients who want to work in a different way and take a more holistic view of how they support them remain healthy for as long as possible. So the population health management program in Surrey is not necessarily around trying to do population health management itself across the whole of our system. That would just be too big a job for a small team to be able to support. But it's more about thinking about defining the right scope. So what are the right capabilities that people at the coalface need in order to be able to do that, to take a population health approach more effectively, and how do then we design a program around delivering those capabilities in a way that then supports people to do that without feeling that we as a central team are trying to boil the ocean. It's really about giving people the capabilities that they need to have in order to be able to apply this approach effectively themselves, and then support them in doing so and helping to identify and spread best practice. Sponsorship is really key, making sure that obviously the leadership within the ICS and our place-based partnerships and the clinical directors of our primary care networks are bought into population health as an approach, and help us to encourage people to use population health and the tools that we generate, or the capabilities that we provide to help people to do that more effectively. And then finally, having an eye on benefits. So having a new thing or a new concept is not in of itself something that delivers benefit. It's only when people use that tool or apply that approach that the benefits for the system begin to be realized. And so your program needs to be focused not only on delivering the physical capability, whether that's a digital platform or a new way of working, or a new team, or some different approach to producing your population health analytics, but it needs to be equally focused on the benefits that will be generated when people use that new thing or new approach, in terms of the improved health and well-being of the population that it will support, and also actually the experience of providing care for our teams. It's really important that they feel like they're doing the best possible job they can do, and population health management and population health itself is an approach that aims to support them in doing exactly that.